Welcome back to my channel. So today we have a new topic for you on cataract. So let me give you what exactly is cataract today, some details about the symptoms, causes, diagnostic options and much more details today. So please stay tuned till the end for complete details on cataract. So first of all, before understanding cataract, you should have a basic knowledge about the parts of the eye. So this is the issue that happens in the eye. So in the eye, you have different parts. So the white part in the eye is called as the sclera. Okay. And the outside part here, okay, in the lens here, this is called as the cornea. The inside here is called as the iris. And within the iris, you have the pupil. Okay, so there the lens is actually present, so that is the reason you're about able to see it, because we will visualize the contents which is there in front of us, and the lens will focus it and send it to the optic nerves. So those details will be sent to the brain, and that is how you can see, you can visualize what you see. Okay, so this is the different parts and the importance of eye anatomy. So understanding this is very important, because the most of the time the cataract happens in this area. Okay, so that is why we are understanding the different parts of the eye. So as I told you, it is a cloudy lens. The lens becomes cloudy. Since your lens becomes cloudy, you are not able to visualize the things properly. The things might look hazy to you. Okay. The main reason for this is the proteins. Okay. In the lens, we have the proteins and the fibers, and some damage to this which happens, because of which the protein starts clumping. That is the main reason for the deposition of these proteins on the lens, and that can lead to hazy condition. That is the reason you cannot see properly. So this is the basic idea of cataract. So this you can see here, this gives you more details about it. This is the normal lens. So whatever you are visualizing, that is focused by the lens and it is reaching your brain through the optic nerve. So here in this case, you can see the object properly, whatever is front of you. But in case you are suffering from cataract, you can see the lens is deposited with this protein material which is clumped, because of which whatever the light is coming to the lens, it cannot be focused. Instead of that, it gets scattered. Since it is getting scattered, the data is not processed properly, and because of which you are not able to see the things properly. It looks hazy, cloudy. So these kind of complaints are usually shown by people who are suffering from cataract, and this is the major reason for it. So coming to the symptoms, as I told you, cloudy appearance, blurry appearance, you may see double. Okay, so you can see blurred vision like this, you can see double, you can see even though there is one person in front of you, you can see like there is two people standing in front of you. So these are the common symptoms which are seen. They are more sensitive to sunlight, okay, because of the cataract effect, and because of this they might be given some prescription glasses. Okay, so that can help to some extent, but usually most of the cases might go with operation, that is the surgery called as the cataract surgery. So these are the different types of cataract which is seen. First one is the nuclear cataract. So in this particular case, you can see the cataract or the deposition happens at the center of the lens. So that is why it is classified in the as the nuclear cataract. The next cataract that we see is the cortisol cataract. In this particular cases, the deposition happens at the edges rather than at the center of the lens, something like this. So this is a classical example for cortisol cataracts. The third one is posterior subcapsular cataract. In this case, the deposition is not directly on the lens but slightly behind the lens. So since it is slightly behind the lens, so this image shows you that, so it is much more not that clear compared to this, right? So this is directly on the lens, but this is slightly away from the lens, but still there is this deposition inside your eyes, because of which there can be the same effect where the scattering of light is seen and you're not able to see the object properly. Next is the congenital cataract. So this is seen since birth in some of people. So you might have seen some people having this kind of eyeball. So here you can see this is from the birth, maybe because of some genetic issues, maybe because of certain trauma or interuterine infections that was happening because of during the pregnancy. So this can be the major reason for this kind of congenital cataract. So in this way, the cataracts can be classified. So when you need to see a doctor, definitely if you have sudden changes in vision, you feel that in your lens there is some deposition which you can see, then it's better to consult a ophthalmologist. So they are the people who can help you. And coming to the causes, one major reason which is seen or predominantly seen, the people suffering from cataract are usually old age people, like maybe 40, 50, 60. So it starts from 40 and it can go even up to 80, 90. So depending upon the age. So age is one risk factor. And one more thing is the sun exposure. So in the case of sunlight, UVB light is more leading to more damage to the eyes. So you need to be very careful. You need to wear your goggles and other things whenever you're getting exposed to sunlight so that you reduce your impact of cataract. So coming to injuries, as I told you, if you have had a accident and you had injury to your eyes, during this injury, if your lens is damaged, then definitely the proteins and fibers present there starts to break down. And breakdown of these leads to clumps, and clumps leads to this particular cataract. So in this way, it's all interconnected. So we need to understand the causes. Apart from that, there is even medical conditions which can lead to cataract. Like if you are suffering from diabetes from very long, and you have taken steroid medications from very long. So these can be some more reasons for cataract development, because this can be side effects of medication. So you need to check on your diabetes, see to it that you keep your levels so that you do not exceed the diabetes limits and then lead to complications like cataract. So coming to the diagnostic options, usually doctors might do a physical examination called as the retinal examination. They might give you a visual acuity test where you might have seen, like when you go for eye checkups, they have these boards with them with the letters written from big size to small size, and they tell you to read the letters closing one eye and seeing from the other eye. So in this way, both the eyes are tested, and based on your clarity of contents which is written there, the how much you can read, based on that they can understand if you are having some issues. Apart from that, the much more important technique which can be used for diagnosis is the slit lamp examination. So this is something like a microscope which is used. So you can see here the slit lamp is here and the microscopic view which magnifies the lens or your eye part to 3D view. So since it is magnified and you can see the content properly with the microscope, this gives more clarity about the condition of your eyes. So the microstructure of the eye can be easily understood by the doctor, and based on that they can suggest if you are suffering from cataract and what you need to do next. So as I told you, the treatment options, most of the time when it is very mild, they might tell you some prescription glasses which is having anti-reflective lens. So this will help in reducing or making the cataract not happening on a continuous basis. So basically, like you are trying to prevent it to some extent so that the long-term effect of it is reduced. Okay, so this kind of prescription glasses may not be working for everyone. To some extent, they will see whether with prescription glasses it reduces to some extent. But if it is not reducing, you are still having a lot of complications, then the only option to you is cataract surgery as of now. So here, when you're talking about surgery, the lens that I spoke about, this lens is the thing which is having the most of the cost. So this lens may cost you from 5K to 50K. So there are different brands and different things. And based on my knowledge where I've collected from various people who have had this cataract operations, so the lens rates from the 5K to 50K. And definitely when you're taking a lens of 5K, the operation rates and other things, when you add, it may come up to 20K per eye. Okay, and if you're taking a lens of around 50K, then your operation rates might come up to 85K per eye. So in this way, your cataract surgeries can cost you. So you need to be very careful. See to it that you try to avoid this condition so that you don't fall in these complications. And now this is how it is done. Basically, ultrasonic probe is used, and using ultrasonic waves, the cataract or the clump of proteins which is seen on the lens or below the lens, so those are removed first of all, and a new lens is kept in that place as implants, and that will help you in seeing whatever is there object in front of you. So this is this picture I've taken from Mayo Clinic. So one more recent thing which is happening is a lot of research is happening in this area to develop new treatment options for cataract. So one is people are working on molecular chaperones. So these chaperones are basically chemicals which are used to solubilize these aggregates. So as I told you, cataract, the main reason is because the proteins and fibers present in the lens are getting damaged and they are forming clumps. So by somehow, if you can try to remove these clumps from these areas, your visualization or the visual impact will be good. So in that way, a lot of research is happening in this area where they're trying to work on these chaperones which can solubilize the proteins. Once they can solubilize the proteins, the clumps are gone. Okay, so the main issue which was there, that is the clumps, can be removed. So that is why some research is happening in that area. And one more area is stem cells. So a lot of stem cell research is happening to treat congenital cataract. So this is the cataract which was seen in children. From the birth you have this effect. So a lot of work is happening in this area where stem cells are used to treat this kind of cataract. So coming to the takeaway options, we have seen that definitely regular eye checkup can only help you from these situations. You can think of having a healthy diet, which includes a lot of fruits and vegetables, because we know fruits and vegetables are very rich in antioxidants. They will help in maintaining your eye health. Apart from that, definitely wear sunglasses when you're going for a lot of sunlight. Okay, so because it can block the UVB rays, and these rays are very, I mean, your eyes is very sensitive to these rays, and on a long run, because of these rays, it can even lead to cataract. So manage your other health problems also properly, like if you're having diabetes, you're having any other comorbidities, see to it that you maintain that condition properly so that it is not leading to severity, and because of overdose of drugs or overdose of medicines there, it is leading to cataract as a side effect. So try to avoid substance abuse, whether it is drinks or alcohol. Please do not forget to take care of yourself. Consult a doctor, that is the ophthalmologist. If you feel that you are having double vision or you are not able to visualize anything properly, please consult them and then take your necessary actions. Thank you for watching. Do like my videos. Do subscribe to my channel Geeks and Geeks, and please share this video with maximum people so that I can make much more educational videos for you like this in future. Have a nice day. Thank you for your support till date. Bye bye.